Another type of payment is health insurance exchanges. Each state is required to establish some form of health insurance exchange by 2014. The advantage of this is having a buying power due to the volume of people involved to create a less expensive health care coverage than it currently is. Exchanges designed to permit individuals and small businesses to shop for affordable health insurance coverage. Here you can see the different tiers listed. The state agencies or nonprofit agencies administer and manage the exchange. They're available to U.S. citizens or legal residents, not to those that are incarcerated. To see more about the health insurance exchanges, review the highlights text box on page 157 in your textbook. This is a diagram of how the healthcare funding through employment-based managed care plans work. Most of us are familiar with this, but let's just make sure everybody understands it. So the employer pays a premium as well as the employees. Usually the employer picks up most of the premium, but that's not always the case. It depends upon the employer. It goes to a managed care organization, and then as the employee uses the services provided by the provider, they pay a copay. And what the managed care organization then does, works at a predetermined set price. So therefore capitation is instituted versus trying to have a charge for the same thing for different people costs differently. Looking at government-funded care, the government has two major programs, Medicaid and Medicare. The risk of this care is borne by the government and the taxpayers. Reviewing the different types of coverage for Medicare. Part A means there's a medically necessary hospitalization or care in a skilled nursing facility or some type of home care or hospice service. It even will cover blood administration in the hospital. Part B is medically necessary provided services, outpatient care, some home health care, other services that are not covered under Part A, and a variety of preventative services. The Medicare beneficiary agrees to allow the service provider to bill Medicare directly for services or goods provided. The service provider agrees to accept Medicare reimbursement without billing the clients for the difference. So this means this is agreement set up between the medical provider and the Medicare and the government. And if there's any difference in the charge, the consumer do not get charged for. If providers do not accept assignment, the greatest amount of the beneficiary can be charged for a Medicare-approved product or service is 15% above the Medicare-approved amount for that service or product. There's a Medigap plan and supplemental insurance to cover costs additional for those services or costs of services not provided under Medicare. Page 158 in the textbook, Table 6.2, really does a great job of outlining the different parts of Medicare. Medicare Part C and D. Part C permits the Medicare enrollees to have the same option with respect to their health care as others in the U.S. and to take the place of the Medigap plans or supplemental insurance to cover the costs that are not provided. This allows beneficiaries to apply for Medicare funding to enroll in a Medicare-approved managed care plan. Medicare Part D states that the Medicare beneficiaries with low income below 135% of poverty level can get assistance with Part D premiums, and those between 135 and 150% of poverty level can receive partial assistance. The deductible varies per plan but can exceed a certain dollar amount each year. After the deductible plan, copayment is paid, usually about 25% for each prescription until costs reach the specific amount. Then with the amount being reached, the person will pay 47.5% of brand name drugs and a specified amount of generic drugs that will decrease by 25%. Then the total drug expenditure for the year reach another set amount, which then a small copayment is resumed for each prescription. Drug costs in a specified window are known as the donut hole or game in prescription drug coverage. The Medicaid and the State Children's Health Insurance Program. They provide services for more than 60 million people in the U.S. Eligibility for services is based on one's income. They're administered by the states, and the programs must provide a minimum set of federally defined benefits and can provide additional benefits based upon states' approval. Medicaid original purpose was to integrate the indigent into the mainstream healthcare. The federal government provided block grants to the states that are combined with matching fund states. Medicaid is a means-tested program, which means that the services are based upon income. SHIP is something set up for each state. This is automatic health insurance covering for low-income children and pregnant women who do not meet the income eligibility requirements for Medicaid. The state administers but is funded jointly by the state and federal governments. Charity care is that provided free of charge to individuals who meet established financial criteria that was never expected to generate revenue. No reliable estimate on the amount of charity care is provided in the U.S. It may be provided by individual healthcare organizations, funded by a wide variety of volunteer organizations and philanthropic foundations. The National Center for Charitable Statistics lists 3 types of nonprofit organizations that may provide health-related services. 501c3 organizations include healthcare and community service agents, 501c3 private foundations that most people provide funding grants to other nonprofit agencies, and other tax-exempt groups, for example, unions, veteran groups, social and recreational clubs. So now we need to talk a little bit more about the health insurance and reform. This is the Patient Protection and Affordable Care Act, or ACA or PACT. This institutes a variety of reforms to health insurance and programs to improve the health of the U.S. populations. The individual U.S. citizens and legal residents will be required to have health insurance coverage that meets minimum requirements or pay a tax penalty, may be a flat fee or a percentage of family income. Employers with 50 or more employees will be required to provide health insurance coverage for their employees or pay a fee of $2,000 per full-time employee. This law also provides for expansion of Medicaid eligibility to all non-Medicare eligible individuals with incomes up to 133% of the federal poverty level. It also maintains state requirements for SHIP programs and changes the threshold for including unreimbursed health expenses as tax deductions. It also provides creation for essential health insurance benefits package. Other changes to private insurance are listed here. It requires 85% of insurance premiums from large employers and 80% from small employers to be spent on healthcare services rather than administrative costs. Healthcare reform continues with the ACA includes a variety of provisions that will influence the health of the overall population. That of preventative health and eliminating cost sharing. Coordination of federal efforts related to prevention, wellness, and health promotion, and public and integrative health systems. This creates a national strategy with goals and objectives to improve health through federally supported prevention and promotion programs. Establishment of Prevention and Public Health Fund to support prevention and public health initiatives include research, screening, intervention activities. It also directs the Secretary of HHS to support planning and implementation of a public-private partnership and media campaign to promote public awareness and education related to health promotion and prevention, primary level of prevention. School-based centers where their clinics are located in a public school and serve that area of community. I know Omaha Public Schools has one, as well as Grand Island is starting to address one.